Hi, good evening once again and welcome to the program Wounds of the Heart. We are here to help you heal any form of wound that have been caused by traumatic experience, emotional or psychological or mental illness. Today I have with me someone that I don't know how you're going to scream because he has been somebody that normally you don't see him around, but today I'm privileged to have him on my set, and he's ready and very poised to deliver what we are here to talk about today. Today, in case you want to join us, as usual, the WhatsApp line is 0559 680066, 0559 606 0066. We are live on Facebook, so tell a friend that, share it with people. Let them subscribe to our channel, Hope TV GH on Facebook, and on YouTube is Hope TV GH. So please kindly subscribe and share for people to also watch the program online. The fabric as usual, Slicker Freak on Instagram, Slicker Freak, Facebook, Slicker Freak. And if you want Slicker Freak, the number is 0557 355 852, 0557 355 852. And this guy who always put me on the flyer and my guest on the flyer, Alpha Art Facebook, Alpha Art Graphics, and Instagram, alphaart_graphics. Just search this guy and please, he'll do a good job for you and you'll love it. The contact is 0551 404 387, 0551 404 387. I always say that Wounds of the Heart needs sponsorship. We don't want to go outside from the studios. We have people in the senior high schools and the tertiaries that they are targeted group, and as this program is ongoing, they might be on campuses, so we want to get them. If you want to sponsor or partner with us, the number is 0559 535554, 0559 535554, and we'll be very glad to have you on board to work with you together. Today I want us to talk about something that I don't know how we deal with it, but I don't know, people think that when you grow is when the mind starts reducing, and they call it dementia. I don't know about it. I know prominent people who are doctors, who are high class profile people, but yet have this form of sickness. We want to know what it is, how is it, it causes, the factors, the risk factors, and its psychological or mental effect, whatever. And today I'm privileged to have the man who always joins me on Zoom. And the other day he promised that when he comes to GHU, he will make it a point to come to the studio. Today I'm privileged to have with me, I call him Senior, Philip Oforiyen to me. Senior, good evening and welcome to the program.
Good evening and thank you very much for having me.
You're welcome.
As I would say, delivered as promised.
That is wonderful. That is what I see. In fact, when you watch it, so yes, it is beautiful to have somebody like that to always be there for us. This program, as I'm saying, that is a program that we need people. If you have this quality to teach, to educate, please. You can do so that we will be able to also use you to help other people. Senior, what is dementia?
So dementia is a neurological or neurocognitive disease, right? So which means that it affects your cognition, your ability to remember, your ability to think through things. That becomes affected, and it's more neurological than just psychiatric. Right, though it's still under the same umbrella, but just for simple terms, yes, it's a disease that affects the way you function, the way you think, the way you're able to remember, the way you're able to process your thoughts and everything. So in basic terms, that is what it is. And it happens at different stages in life. Typically, we see it in the elderly, but it can also happen in people who are in their middle age.
So forgetfulness, or what? Should we say that? In
simple terms, yes. They become forgetful, and not just forgetful. They are not able to do simple tasks. So it may get to a time where, addition, multiplication becomes an issue, right? So they process it. And then also, they forget to even brush their teeth. They may be eating and then they'll be like, hey, I'm still hungry. You guys have not fed me in like days. Whilst their hand is still in the food because they are not processing.
That is the apex. That is the seriousness.
Right, when it advances, yes.
So it is normal for all of us to have to forget about certain things, because if there's no forgetfulness, there are issues that probably as a still now we'll be still crying about it.
Exactly.
So forgetfulness is fine, but when it is not the normal way to forget about something,
right,
then we are talking about dementia.
So not just the normal way of not able to remember or being forgetful. This is forgetfulness to the extent that their ability to perform ADLs, which is activities of daily living, right, becomes affected. So they are not able to prepare their food. They are not able to go to the store. They might not be able. They will not be able to drive. They will not be able to remember who their children are, right? Some of the activities that they did, and sometimes they might have the long-term memory loss or the short-term memory loss. So depending on where they are in the process, right, or what stage they are, and what symptoms they may have. So the symptoms will vary from one to the other, yet in simple terms, it comes with serious cognitive deficits.
Okay. So if you know somebody that you've known that person has dementia, I think that it's a good way for us to learn something new about it and how best we'll be able to help other people. And you know, the program is to help people, help people, and even how best you can even cope with those people who have these issues or such issues that we speak about. What are some of the facts when it comes to others have mates about some strange mental health issues or psychological issues or neuro issues, but when it comes to dementia, what should we know about it? Do we have statistics? Do we have something that should let us know that, hey, dementia is something that we need to take good care of it?
Okay, so one thing I typically like to do is when I'm doing an education for the general public, I don't try to get too much technical or too much with statistics because it may bore people with it. So I want to get as practical as possible and bring it down as much as possible. Right? So talking about factors, one, I always talk about genetics and environment. Right? Genetics and environment. So these two things affect people for various reasons. You may be genetically predisposed to a condition because your parents are. So let me liken it to a medical condition because that's what we mostly know about. If somebody has hypertension running in the family, it's very likely that that person will also have hypertension, right? So if you in your family you have dementia or Alzheimer's, which is a similar condition, but one is diagnosed after death. When we do the autopsy and they scan the brain, that is when you'll be able to, right? So if we say dementia or Alzheimer's interchangeably, please, it's just about the same thing. So if somebody in your family or it runs in your family where there is dementia or Alzheimer's, it's most likely that you also may get it. The other thing is also environmental, the brain activities. If you're not doing much to train your brain, then it's a muscle. Use it or lose it, right?
Do you have a special course about how to train the brain?
It's mostly doing simple things as reading, doing puzzles, board games, stuff like that, right? So anything that challenges your brain, anything that gets you to really activate your brain. Of course, your brain is always at work, right? Until death. Your brain is always at work because there's always an activity going on. But is it challenging enough? Is it something that you feeding your brain with, which will make you a better person, or really exercising it, right? So you just working and you exercising, there's a difference. And I want to use that for you to understand what I mean by exercising the brain.
Exactly. Do we have types of dementia?
Yes, we have different types. We have one that it could be caused by substance, right? So an example, alcohol induced. Right. So people who are alcoholics typically will have the form of dementia, sometimes too medically induced. So if you have cirrhosis of the liver or other conditions, it could give you cognitive decline, which will give you dementia-like symptoms. Also, this is one that people really don't pay attention to. Sometimes if you have UTI, right, urinary tract infection, yeah, it's most likely that when it's advanced, depending on which kind, you can have cognitive decline or dementia-like symptoms, right? So sometimes when in our homes, in the villages especially, when we tend to label the elders, especially the women, as witches, it could be just UTI. And I say that with a smile because I think it's something so simple that we miss, and then we label people with some huge.
I think this UTI thing, we need to also take it up and discuss it as one of the part of the program, because this is not the first time you have used this as an example in your speeches when we are dealing with programs like that. You always say that because of that, people still think, and we need to talk about the effect, this UTI thing, so that when our fathers and mothers are getting to a particular stage in life, we will never term them as witches or wizards because of their actions, but probably might be a mere medical condition that should be dealt with. I think that we need to talk about it. We will. So continue.
Okay. So it could be something as simple as UTI, which, you know, just using maybe cranberry juice, more fluids, or an antibiotic, and then they'll be fine, right? So if we let go of all these, and it gets to a point where now we are labeling them or taking them to prayer camps and all of that, I think we're missing the point.
Exactly.
Okay, so that is just another thing that can happen that will give you those kind of symptoms. The other thing also is, you know, with your cognition or with your brain, each part works differently. So the frontal lobe helps you to remember something, right?
Exactly.
In simple terms. So let me give you an example. If you're trying to remember something and you forget, what do? You hit your forehead, right?
Yes.
Yeah,
Okay.
it just comes natural, right?
Okay.
Yes, but there is a science to it, because that is where your cognition is. That's where it helps you to remember.
So then it means that we need not to play with this side of the
Actually, we need not to play with our head, period. That is why concussions, if you have concussions over a period of time, it does affect your cognition, right? But then the hitting of the forehead, I just said that to
It's
make
natural,
you to just remember where your cognition is. And I think I like to put in some of these things, right, analogies and stuff like that, because it makes it to sink in.
Exactly.
I hope it does for you. So it makes it to sink in. So if it's your dementia, it's affected by the frontal, then you get forgetful very early. And also depending on which part and what kind of forgetfulness that you get, right? So yes, it may affect one part. So the symptoms are not the same for everyone.
Okay.
Exactly, because of where you are, you may be affected. That just like if you have stroke, right? If you have stroke on the left side, the left side of the brain, the right side of the body is affected, right? So yes, it's very similar. So with that analogy, your dementia, with your dementia or Alzheimer's symptoms, it may be 1 from a medical condition, 2 from substance abuse, and 3 genetics. So now that is the genetic part. The other one is the environmental part. And you keep hearing me talking about genetics and environment, right? Nature versus nurture.
Nature, okay.
Yes, nature versus nurture. Naturally, this is who I am.
Exactly.
Where I was nurtured, how I was nurtured also can affect me.
Okay. How do I know somebody has dementia? What are the signs and symptoms of? Okay,
so you live with someone. So this is someone that you have to know their baseline to know if there's a change, right? Unless you're professionally trained, I don't really need to know your baseline. And talking to you, I can tell that, yes, you are cognitively impaired. So one, you have to know the baseline of the person. Then you realize that they are going off their baseline. So example, you live with your parents or you know your parents well enough. Now you talk to them about something today. You try to talk to them about it tomorrow. They don't remember you had that conversation yesterday. That is a problem. Right, so we're talking about memory. Yes. So that is when they have the short-term memory loss. So this is the other thing too that I think is a kicker for me. That's why I'm smiling. This is the other thing. When they have this dementia and they have short-term memory loss and typically have the long-term memory intact, what happens is they talk about things and people that they related with or did when they were younger. Right? Okay, so this is what is happening. You go to the house and then your cousin who lives with your mom or the elderly person start to talk about, oh, she's been talking to the dead, right? Oh, I didn't some for nekasa, right? Then, oh, yeah, before, about friend, and that's what friend some for. So what I'm trying to say is, we typically say that, oh, he or she is talking to the ghost or the dead, and he's calling the dead, right? No, they're not calling the dead. They're not doing any spiritual voodoo something. No. What is happening is that they remember when they were much younger. That memory is very intact. So they can talk and describe things vividly as to how it happened. The people that they are talking about in that context, you do not know them, so you think they are talking about a ghost. So yes, it may be people that are dead because they predeceased the one that is talking right now. So yes, those people may be dead, but it's not that they're having a conversation or they are calling the dead, or it doesn't mean that they're approaching their end of life because now they are communicating with the ghost, so the ghost is going to call them home. Far from that, right? So once again, we see these symptoms. Oh yeah, he killed or she killed this person, and that is why they are talking about them, right? Oh, she did this to this person, and that's why she's talking about it. No, they are not talking about it because they were involved. If not, they would have said that some of them actually crucified Christ. Do you get my point?
Okay.
Right.
Okay,
but the death of Christ way pre.
Exactly.
So no, it's not because that they were directly involved or they were the causal agent or because they were any part of it. No, it's just because that part of their memory is very intact and they can remember that. Then you question yourself, oh, then how come what we talked about last week, they don't remember the Bible, they remember this? It is not because they are in a spiritual realm and, you know, talking about the spirits and stuff like that. No, it's just because of the illness that they have going on.
So aside that, with for instance, that person may be a high class profile person where you know him, you know the person, and all the time I've seen this man who will dress but then forget about wearing a shoe and will sit in the car and just move. He'll get to the work before realizing, hey, is it a symptom?
Yes, it is. It is a symptom. So part of the forgetfulness. So they dressed up, they forgot to wear a shoe, they already stepped out. But please, let's not confuse this. As you earlier on said, there are some times where you just become forgetful. You walk into the room, you don't remember what you were going in there for, you have to stop for a minute, or you have to go back to where you were when you were doing the thinking to be able to remember what you went in there for. Some level of forgetfulness, please, is not dementia. And I want to state, please do not leave this program going around diagnosing people.
Exactly.
Please don't do that. Exactly. Okay. But then what I want to say is that it gets to a point where they get so forgetful. Yes, it may include forgetting to wear a shoe and then stepping out like that. You also may get to a point where they will forget to eat, and that is why they get dehydrated a lot. So dehydration also comes with a lot of headache and a lot of medical problems, right? So now, if they are dehydrated and now they start having headache, it's very difficult for them even to communicate it to you. Therefore, it shows up as behaviors, talking about symptoms, right? So with dementia, cognitive decline, and it gets to a point, they start to have behaviors also. So they might have irritability, getting angry so quick, agitation, now getting physical or verbal, right, with an individual. So those are all parts of the symptoms depending on how they're going on. Pastor, please stop me anytime because I can just
go for me. When I want you to pause, I'll come in with, because you in as much as we are discussing something that my viewers probably still, we hear about them. We haven't taken time to study, because yes, I'm a banker, I'm a whatever, why should I go learn about this, why should I go back? But sometimes when you have these people who are into that, sitting in front of you to talk, you keep quiet for them to talk. You are early 40s, you are in your early 40s, you keep on saying, and tell me really fear there. I mostly forget about things. Can it be a symptom?
Yes, it can. It can. Especially that is when you have to start digging into your family history, right? Did you have a similar problem or same with your grandparents, with your parents, your uncles, cousins? Did you have a similar problem at home? If you do, yes, then you have to start thinking about it. Sometimes we think that if we don't think about something, it does not exist. Please, anything that has a name exists.
Exactly.
So if you don't even think about it, it does not mean that it does not exist. It does.
Yeah, viewers, in case you just joined, we are discussing this topic, dementia, and you've heard about dementia. You know what? I don't know. Now you know what it is. You know what the fact about dementia, environmental, and how you were brought up, your genetics. And we just finished talking about it. Some signs and symptoms for us to know that this person should be very careful because he or she is approaching the degree level of dementia. Because I don't know that we need to bring certain things up for you to think about it. In case you want to join this conversation, WhatsApp line 0559 680066, 0559 680066, or we're still live on Facebook, and you can just send your comment or your questions, and we'll have time to read them and answer them at appropriate time. We are still discussing dementia, so if you have anything concerned about it, you can just quickly send us and we talk about it. Then what are the causes of dementia? What causes dementia? As
I earlier on said, genetics and environmental. Mm-hmm. So those are the two main causes, right? Substance, part of it, medical, part of it, and then, the way you form.
The medical being a wrong diagnosis of drugs or what?
No, not the wrong use, the misuse.
Misuse, the abuse.
The abusing
the normal drugs we take.
So, not every drug though, because if you take your malaria medication and you even take an extra dose, no, that would not cause you to have dementia. But then I'm talking about alcohol especially. Alcohol especially can alter your mental status and lead to eventually having dementia symptoms, right? So now, when we talk about some of these causes, I've talked about the medical, I've talked about genetics, and that's why you have to know your family tree. For those, especially newer generation who want to detach from the family, please be mindful because it's always good to know your history. So it's always good to know that family history and know what goes on in the family. The other thing is dementia is not curable. Yes, it's not curable. If it's dementia, it's not curable. But then we can slow down the progression of the disease. You get my point?
It's manageable.
It's manageable, but it's not curable. So you can have malaria, we'll cure the malaria, right? Right. So dementia, no, it's not curable, but we can slow down the progression of the disease with some medications and some.
Don't let it come to you. Yeah, continue because something that's not curable.
Yeah, but this is what I always say. There are so many health problems that we have, right? You do not call them on you. Some of them is not your it's not your fault. It's no fault of yours that you may have some form of cancer. It's no fault of yours that you may have some form of fever. It's no fault of yours. So what we can prevent or what we can do to delay it or prevent it, yes, let's do it. But others that we cannot do, if we can help it and it does happen, let's understand it's illness. It's with us. We live with it, right? Thanks to sin, we live with these things. So let's not treat it any different from any other medical or psychiatric conditions. It's just about the same. So I was making a point, it's not curable, but it's manageable. Yeah. So we have certain medications that when given, it slows down the progression of the condition. Right. The other thing is dealing with people with dementia. If I should get into
you shouldn't. Don't get there now.
Okay,
we'll come on that. You're talking about causes.
That is why I said stop me.
I'll stop. I've entered. You see, but with the causes, you said environmental, genetics, and drugs. You said, but what of a severe accident that probably affected the head or something?
That would be a TBI, traumatic brain injury. Okay. Right. So with the TBI, you have a brain injury which may affect one part or the other of your brain. And when that happens, yes, it may affect your cognition, but not necessarily dementia.
Okay.
Right? Yes.
Okay.
So you can have TBI, which may get you to be forgetful, get you to be aggressive, get you to be irritable, get you to, because it's the brain. So once it's affected, some level of functioning of yours will be altered. But that is not necessarily dementia.
Okay. Okay. Well, we are learning. We are learning. Sometimes you need to go have a job somewhere and just put down certain things that will help you also for yourself, not even for some people, for yourself, because you might not know whether you have are there any risk factors when it comes to?
So the risk factors are the causes genetic predisposition makes you a higher risk factor. Right.
Okay. Then what are some of the effect that effect when it comes to that dementia?
So one effect, which for me is very pathetic, I have my grandma, right? One of my grandparents. She has early stage dementia.
Early stage from which side? Because I want to ask, even when you are done with this, I will ask at what age do we still think that dementia can set in, or do we have? Does it only happen when we are grown? We have that myth. So just finish with the causes and the effect, and probably as part of where I'll ask that one.
Okay. So she has early stage dementia, and yesterday I went to my hometown with my family, and when we're coming back, I was discussing this with my brother and my sister, and I talked about, this is so, I think for me personally, it's one of the worst conditions anyone can have. And when I said that, my brother was like, Master, what do you mean? Because our other grandmother had just died of cancer. So we went for the 1 week celebration, right? So he was like, this one just passed with cancer. So how you go fit tell me, say, dementia be worse past this one? Because this one he died, this one at least he did. So this is my point. Yes, this one is there, but it's there physically, but dying psychologically. And it's also very difficult for the family because you've lost someone who is still present. I don't know if it makes sense.
Exactly.
Right?
The person is there.
The person is there. They cannot have meaningful conversation
with the person.
You. They cannot remember who you are. That is the worst part for me. That is the worst part of me. When they lose that part of their memory. For me personally, that is the worst part. Imagining, I've known Pastor for some time, and then it gets to a point where I'll be like, oh, Pastor, this is Philip, I'm back, how you doing? And then he looks up at me and then just looks down and be like, who are you? Kai. So that is a friend, right?
Yeah, I get it.
So think about it, a mother and a child. Hi, that breaks my heart all the time. All the time. I had one patient where the son came there every single day. The son came. And the mother never remembered who this boy was. And the lady, the patient, used to be a professor. So I'm talking about you don't have to be, there's no social stratification that excludes you from having it. She was a professor. With all the knowledge, she taught for so many years. Now she could not even remember to brush her own teeth. And did not remember who the son was. The son would be so devastated and cry every single time he came. But he also came every single day, 7 days a week without failing. So it is very, very, you're talking about the effect. The effect it has on the family, on the patient. On the patient, the early stages is difficult for the patient. When it advances, not so much for the patient because they don't remember so much of what is going on. But then for the family, that is when it also becomes extremely difficult for the family. Thankfully, as I said, my grandma's is still early stages. So when we went, she was able to recognize at least my senior brother, not so much of me. Though I went to see her last 2 years. I went to see her. She could not remember who I was. But then saw my senior brother who she had not seen in so many years. Talking about long-term memory.
Yeah, exactly.
She was able noticed him, called him by name, but then could not remember. Until I introduced myself and mentioned my mom's name, you were like, oh, right? So now she had to connect it to my mom. So that is how unfortunately it happens. So she's still there. You can have some conversation with her. She's still aware of her environment, her surroundings, what is going on. But then that is what I kept telling my cousins and my brothers. There will come a time, let's prepare for it. There will come a time where unfortunately you go and you'll be like, Kofi, it will come. That's
so the one. This one is for the family tie. Dementia breaks that family tie. What else?
And this is the other thing too. So interesting. When I was coming, right, I was watching a movie on the flight, and it said "Still Here," and it's about a man who was an artist. Mm-hmm. He was having dementia. Did not want to tell the family about it, which is the son and the daughter, because they had some hatred for him for something that happened years ago. So he felt that if he was to tell them, they were going to be mad more or angry at him the more. So he did not. But they met a stranger on the street who he took in and started telling the stranger everything. So now the kids became angry at the stranger for taking over their father. So they once came to the house and then, were telling them, the stranger their peace of mind, right? Just at them. So when they were doing that, then the stranger was like, now let me tell you what, your father needs me more than I need him. And this is what he's going through. And you guys are staying away. Very soon you are going to lose him. The lose is not death. The lose is very soon he's not going to remember who you guys are. Absolutely. So you better stay with him now. Spend some quality time with him now before you lose him. So talking about the family dynamics, how we deal with it, how to manage it and everything. This is the time to spend the most quality time with the person as much as possible. Before I came, I was talking to my little brother after we lost our grandma, because she passed away with us in the States.
Okay,
right?
okay.
So I was telling him that two things. Which one would you prefer? To know you die and prepare, or not know and then just go? Answer that question. Have that discussion at home. Which one would you prefer? And I think it's about time that as Ghanaians, culturally, it's very difficult for us to have certain discussion, but I think we have to have end-of-life discussion because it's something with 100% mortality rate.
Senior, no one want to talk about it. Even with our oldies who we know that very soon they will die.
Or they won't pass over.
Exactly. So it is difficult for us to. This one, they Ghana, they're fine, but probably in the state they will be able. But here, they must have never come.
But I think we have to move past that. So the question is. We are talking about dementia, so I will not move too much from it. Let me stick to the topic. Which one would you prefer? Now, I have dementia. I know that my cognition is going to decline. Would I want to have this quality time, talk about how you guys grew up, what you've been through, share some moments with that individual. Enjoy the person as much as possible before you lose the person. At least that is one opportunity that this gives. You see it coming, you prepare for it. I also watched one movie. I'm not a movie person, so it's interesting I'm talking about movies today. I watched one movie also where the mom of the girl was having early stages dementia. The girl was 60 years and was still in school, JSS right? So the mom did not want the girl to know. So what she did, and of course in the States is common, she hired an apartment for the girl. And then gave her a car. At that point, you can drive with your temp license. Gave her a car and then asked her to move out, so that she goes through it alone. So this is another point I'm trying to make. It's a form of grieving, and people grieve differently. So this parent did not want to take the daughter through the ordeal of dealing with a demented mom, right? So later on, the girl did not feel right as to why my mom asked me to leave the house. Then came to have the hard conversation with the mom as to why would you do this to me? Because though the mom thought that she was pampering or giving the child
the freedom to just stay away,
and the freedom to her lifestyle, the daughter also noticed that, no, we've always bonded together. So why do you want to get rid of me now? So let's have that hard discussion. Then the mom disclosed to the daughter that this is what she's going through. Then she was like, Mom, I cannot leave you, and I'd rather stay with you if I even have to take some time off school, right? So this is the family dynamics that you have to deal with. Some people may want to grieve in silence. Some people will want to grieve with company. Some people want to grieve with limited company. So not everyone would want the public to know about what they are going through, right? So with all of this, we have to be cognizant of it. And that is why I said it's about time we have certain conversations. How would you want to be treated? If this is to happen, how do you want us to go about it, right? So when you have this discussion, then we know how we are dealing with your situation, respecting your wishes and your dignity.
All right, so I said I will ask, how can it be diagnosed way back from when somebody is, how do we do that?
Until the person starts to present symptoms, no, you cannot diagnose the individual. So as I said right now, as far as I know, I don't have it, right? So you cannot start diagnosing me that, hey, Philip, in 10 years you have it, in 5 years, no. Right, or you have it
unless
now.
Unless the symptoms have been exhibited.
Symptoms. And even with that, it has to get to a certain level of symptoms and some manifestation of behaviors before we diagnose you with that. Because there are other conditions which may mimic that of dementia. As I mentioned, if somebody has UTI and is exhibiting steady behaviors, and you conclude that it's dementia, and you are not treating the UTI, the symptoms will continue. And you're just going to make that person sepsis. So you have to do you have to rule out certain conditions, monitor for a certain period of time, and then you'll be able to tell, okay, this is what this is versus what this is what that is. And in some cases, to even determine what kind of dementia that you had or Alzheimer's that you had, or less after death. And then the family will want to do an autopsy, then we scan the brain, and then we'll be able to know, okay, which part of the brain was malfunctioning or what really happened. Yeah.
So you have this little boy, little girl at home, a child, say 2, 3, 4, 5 years, and this child start exhibiting certain, like he or she doesn't remember what happened yesterday, or probably even putting something on the table. She forgot, or he has forgotten that he was the one who placed that thing there. Should we, the parents, should we be? We
should be worried, but not worried because it's dementia. We should be worried because it could be other neurocognitive conditions that the kid may have, right? So yes, we should be worried. We should be worried because it could be a learning disability. So yes, we should be worried, but not because it's dementia. In terms of when we typically see it, usually after age 50, you may see some symptoms, but typically after 65. That is when we usually.
I know you started laughing because you're induced here, but let's be careful. You know what I'm saying? Because at the end of the day, you may be working now, effectively working now, and you come to what we call a pension or retirement, and when you need to enjoy your worth, that is where this dementia thing has set in, and you will never have the privilege to do that. We are working on that. I know that for us to be fine, he may tell us about exercising or working well with our brain, or even our eating habits should change. So I think that, but with one of the effect, we'll hear doctors do surgery and they sometimes forget to leave certain apparatus in the womb or whatever. What of that? Is this a mere forgetfulness?
Oh, when the surgeon does that? Sometimes it's negligence. Sometimes it's just negligence, sometimes it's mistreatment, sometimes it's just mere forgetfulness, sometimes it may be just an accident. Yes, I think that also happens. It could be just an accident, it could be negligence, but it could also be that that person has, because you know there are some people that function in the society, in the community, but they do have conditions. Right? So I'm not saying that because somebody has some condition, whatever it is, they should not work. Far from that, because I'm a proponent of do what you can until you cannot do it anymore. Right? So if somebody has bipolar, that does not stop them from working. If somebody has Alzheimer's, depending on where they are. Talking about the movie that I watched, not the professor that I treated, but the movie that I watched, she was still teaching.
But
she was still teaching with the dementia. She was still teaching. But then the board realized that some of the teachers realized that she was acting a bit differently than she used to.
Then that was a problem.
Right. So they started noticing that. In that case, what can she still do that would still put some usefulness, meaning to her life, right? Because once you take away everything also, that will also depress the person. So you don't want to take everything also away all the time at once. But then what level of function can they be at and still be meaningful to the society and also have some purpose and meaning to their life? So it's a balance that we have to find until it gets to a point where we realize that this person cannot do it anymore.
All right. So how do we help people in such, with a family tie, with society, with a church? How do we help people, and how do we cope with people with dementia?
Let's not discriminate, right? That is a word that is not typically used in the Ghanaian setting, because discrimination is usually used with race, right? But we have so many other forms of discrimination that happens among us, right? So let's not discriminate because somebody has any condition whatsoever. So if my grandparents or my parents or myself is demented and I'm to come to church and then I'm being looked at differently, or my parents is being looked at differently, they are being treated differently, it's like, man, you are a menace to the community at this point, that becomes more difficult for the family to handle. And as I usually say with kids with ADHD, if I am to deal with that person on the average 16 to 20 hours a day, because sometimes they don't sleep so much. So if I'm to deal with that person on the average 16 to 24 hours a day, right? And you have to deal with that person for 3 hours, and you think you have a problem, think about me. Sometimes when we empathize with people, when we put ourselves in people's shoes, though my shoe size may be bigger than yours, but when you put your feet in my shoe, if even you realize it's bigger, you realize that, yes, I'm doing so much carrying that shoe.
Exactly.
Right? If yours is also bigger than mine and it's so tight for you, you realize that, yes, I'm still going through. So the point I'm making is that let's put ourselves in the shoes of others.
Exactly.
And we will notice what they're really going through. If you think that an hour with you is so much, think about that person. The other thing is, if you are able to give me an hour break from not dealing with what I'm going through, that is a huge relief for me as the family member, right? So if I have a demented parent or relative that I'm helping take care of, or I'm the caregiver, we have something called the caregiver burnout.
Exactly,
It will get some time, as much as I love that person, Masa, body no be firewood.
Exactly.
Right? I'll get tired, I'll get weary. So please, if there are people around, you work, I understand you're a friend, but cut in here and there, give the person a slide, an hour here, 2 hours there, so that that individual too can catch a breath. If not, it gets overwhelming for the person, and then it may show in the care that they give to the individual.
So if it's someone that's watching us probably has seen these signs and symptoms of dementia we spoke about, how should the person live? What should you do? As
the patient, if you see it in yourself.
You started seeing.
So personally, I will always say that talk to your family about it. There are a few individuals that want to keep it to themselves as long as they can, right? But if you do that, this is my view of the dangers. If I don't know what pastor is going through and I see pastor acting out of the norm, I will take it differently versus if I know what pastor is going through and then I see him acting one way or the other, right?
Yes, exactly.
So it's always good, in my opinion, to let the loved ones know that, hey, this is what I think is happening to me. This is what I've noticed. So please, if you realize that I'm getting forgetful, it's not on purpose, please let me know. If not, they'll still try to cook and everything.
Okay.
So if you have an electric stove, and they probably don't remember, or gas, and they don't remember, they leave the food on it. The gas is still running. Or they turn on the gas, they forgot to really light the burner.
The burner, yeah.
And then the gas is still running. You don't know, you come home, you light something, and then the whole house is on fire. Do you now blame who? Right? So once I notice it, it is just proper to let somebody know. Once you know, yes, you can still leave me alone for certain things, but you do that with caution. right? So if there are any risk factors around, we try to mitigate it. You know, do we have to move certain things away? Do we have to do this? Because it may get to some time where they may be disoriented to even their own room arrangement. So you don't want to keep these side tables, anything they can bump on and hurt themselves and stuff like that. So you want to keep it maybe more foamy stuff like this. If they bump into it, they don't get as hurt as that, right? So it comes with more management of the environment, the space, the mind, and everything. So it's always proper to let someone know. But in our culture, everything is a secret, including our date of birth.
So then we have the football age for our age, we have the normal age on us. So if you ask somebody with this, so what do you want? Do you want the real age or you want it? But well, we all go die. But when we are dead and gone, obituary will have our real dead. But in as much as Senior is taking us through this dementia thing, you know, whoever has with dementia, that person is that we shouldn't discriminate.
No.
And I think that we need to get closer to those people, get them happy, and let them enjoy us around them. I think that probably also will help these people who the dementia patients to also overcome certain things. Because let me ask this thing. Why is it that high-class profile people, the learned, the elite, are seen with dementia?
It's seen in all classes.
Oh, but it's probably.
See, let me tell you why.
Tell me, because mostly we see it in high.
Please forgive me for my analogy.
You are forgiven already.
If an Ashanti is to be a watchman, he's called security. If a Northerner is to do it, he's called a watchman.
Watchman, yeah.
Se minis kana se minye bia me before. Se mos kana minye bia dementia. Do you get my point? Right? So always the one who is not wealthy, they'll be classified as a witch.
Exactly. I get
so
that.
It's not because they don't get it. They do. This is not an illness for the rich or the wealthy. No. Anyone at all. And I can always give examples. I've taken care of patients. When he was 85 years old, he taught for 60-something years old in a for 60-something years in a university, right? He had dementia. The professor I was talking about, the lady, also had it. I've also taken care of people who were house help, cleaners, stuff like that. So no, this is not discriminatory. It's not. The predisposition factors or the risk factors are what we already talked about. Outside of that, Master Pesca, dementia.
All right. So, viewers, I think you enjoyed every bit of what we discussed. And though we need not to make it so serious for you to get heartache, but we need to put a little bit laughter, so that you know that in as much as it's serious, we still have the way to go around it. So we just treated dementia. It's something that we hardly talk about it, but it is everywhere. It is everywhere, and we might pose to those people, those with dementia, that they are something else. We shouldn't laugh at them. Sometimes you see this old man who has forgotten about something and say, hey, Western, you haven't gotten there yet. He said it takes off 60 plus. So the fact that you're not there doesn't mean that you are dead. So my time is up, Senior. Our time is up already. And viewers, I want you to help me appreciate Senior for fulfilling his promise. You know what I'm saying? He promised to be here, and today he's here with us. And I will have him for some few moments in this studio before you leave to the States. So when you are saying a prayer, say some for us. This program was by Slicker Freak. Slicker Freak gave me this fabric. If you want Slicker Freak, Instagram Slicker Freak, Facebook Slicker Freak, and your numbers is 0557 355 852. Just call them and they will just deliver it at your doorstep. Alpha, God bless you for always making me up there. And if you want anything sort of graphics, if you want anything like that, just contact Alpha out on 0551 404 387 0551 404 387, and Alpha Art will be there for you. And as I said, if you want to also push this program, Wounds of the Heart, if you want to sponsor this program, the contact is 0559 535554. We'll be very glad to have a chat with you to see how best you move on. Senior, thank you so much for your time, and
it's an honor.
Yeah, may God bless you, and may He extend your tentacles to whatever you desire from Him. May He allow you to achieve them in life. And
Amen.
When I'm done with you with all things that, when you're also going back, may God take you safely back there. Amen. So that we'll hear from you on Zoom, not physical again. All right, viewers, thank you so much. And I've been your regular host, and the name is Pastor Daniel Bedu Bidiaba. I'm out.